So, Mr. Shravan, my first question to you is, how will digital or digitization improve patients' engagement and satisfaction?
Yeah, thanks. That's a great question, and I'm so glad that you're asking it from the patient standpoint, because once patients see the value of it, it empowers them, and as they get empowered, it really makes the healthcare institutions also adopt this. Today, consumers are empowered digitally in all aspects, whether it's in banking, whether it's in travel, insurance, what have you. Why should health be any further behind? If a patient is going from one hospital to another, they should have portability of data. They should be able to access the data. It should be interoperable across any health system or any hospital. So it is imperative, and it will happen, and it shall empower the patient. Thank you.
So, Mr. Shravan, we have noticed that many providers find that the initial time taken to digitize as a roadblock, right, and to go digital. So, to them, what would you say in the return, in terms of return of investment and incentive for going digital?
Good, yeah. If you look at it again, all industries have gone digital. Healthcare has had some challenges because of lack of standardization, probably, and depending on the city, depending on the size of the health system, some of them are more advanced, some of them are not so. But either because of COVID or because of available technology, this is now happening at scale, and we're seeing an exponential increase in healthcare digital adoption. Actually, I would like to bring to attention this document that we have put through with support from Arthur D. Little. Terrific document which shares how we stand in terms of digitization, how some of the hospitals are already well digitized, and what needs to be done to digitize them further. ROI initially might take some time because there's a lot of hardware and upfront investment that they need to make. The process of integration will also take some time and effort. But over time, it is something that is an imperative. It has to happen, it will happen, and the ROI can first be seen in terms of patient satisfaction and clinical outcomes, and then of course follow in rupee terms.
That brings to me my next question. How can we convince physicians to adopt this digital thing and go away from the pen and paper to records?
So look, I'm a physician myself, and it took me a while to go from pen and paper to records. I think it's that ecosystem that needs to keep pace also with the clinicians' needs. If we are adding value to the clinician and they see this improving clinical outcomes, also it's the ease of operation. If there are simple things like drop-down menus or predictive text, predictive analyses, these will really help clinicians. We're already seeing this in the radiology space, in the pathology space, where they've gone very digital. They've already introduced AI applications which make their life easier. And today, you can't go to a single radiology center or a pathology center where things are done on paper. Everything is digital. So this is bound to happen in other aspects of clinical practice as well. And I'm seeing a lot of clinicians, whether they're in the city or tier 2, tier 3 locations, they are adopting digital means. It is bound to happen. Technology is growing, and just as you're comfortable using an iPhone or an iPad or any other tablet and device, that is also entering their day-to-day practice in healthcare.
Thank you so much, Mr. Shravan, for joining with us.
Thank you.